Awesome. All right. Well, it is 9 o'clock, and I do want to make sure that your time is honored. And I know that we've probably just finished the busy morning, and hopefully we can get some good information for you in this morning before you have other things that other other needs on your time for this today. So I wanted to take a few minutes to, or just a couple minutes actually, to show the agenda and go over our housekeeping issue or items with you. So today we will be having or reviewing the Washington 211 resources with Kate Irwin, and I'll let her introduce herself a little bit more for us. Washington 211 is a service that's been around for a while, and I myself am not really adept at using it. So I was hoping Kate might be able to help us learn how to incorporate some of those resources into our practice with our students and their families. And then we will have Lori Dills on to review the new sex trafficking prevention requirements. And just a heads up to you, we won't be able to record that portion of our meeting today. And then after Lori, sadly, Dr. Wallace is not going to be able to join us this morning. So we have Kathy that will be doing our school nurse updates. And then if there's any time left over, we will have a brief discussion on PD enroller and clock hours. So that is our agenda, and you can still see my screen, right? Okay, good. All right, so as usual, our meeting objectives are to get updated information regarding resources, practices, and opportunities to incorporate into our practice so that we can safeguard our students' health and safety. Our goals are to identify 2 of those resources. Hopefully you can find more out of our meetings than just 2, but we always try to follow the framework with quality improvement, leadership opportunities, public and community health, and care coordination. And as always, this is usually recorded, but today, like I said, we will have a brief intermission in the recording during Lori's presentation. But please keep your microphones muted. If you have any questions or comments, please raise your hand or put them in the comments in the chat. And Sheila and I will be monitoring that so that we can help get your voice heard. And as always, there's clock hours. And if we have time, we'll go over a little more information about clock hours themselves. All right, so I'm going to stop sharing my screen here. And if I can.
Lena, you're not sharing your screen right now.
Oh, I wasn't the whole time?
No, we're looking at you.
Oh my goodness, I'm sorry, everyone.
You look good.
The slides were laid out beautifully too. I'm sorry you missed all of those beautiful slides. Anyway, I'm going to turn the time over to Kate to talk about Washington 211 with us.
Awesome. Thank you. And I will make sure I'm sharing my screen before we get going. Hold on one second. Okay, so hopefully you guys can all see my screen, and hopefully you'll see a slideshow here in 1 second. Give me 1 second. There we go. Hopefully you guys can all see the Washington 211 beginning screen. Good, perfect. Okay. So my name is Kate Irwin. I am the Quality Assurance and Training Manager with Washington 211. If you guys are seeing me kind of look over here and you're seeing this side of my face, my apologies. I was born legally blind. I have a gigantic screen over here so I can see what's going on. And for whatever reason, as big as it is, well, I know why. There's a webcam up here, but you'd only see the top of my head. So I use the one on this laptop that I have in front of me, but what it means is that you guys get to see the side of my face when I'm really trying to see what's going on. So my apologies for that. Hopefully it's not too disconcerting. But trust me, you don't want me to be right. It would be terrible. It would be horrible. Anyway, so I am here today to talk about Washington 211. Please do not in any way, shape, or form be concerned if you are like, goodness gracious, I've never heard of that before. What is that? I have sat in boardrooms next to people for 6, 9, 12 months and then brought up, oh, well, you know, you could forward someone over to 211 and had them say, now, what is that? So if you've never heard of it before, 100% you will know about it after this today. And please feel free to reach out to me. My information will be at the back end here of this presentation. If you have any questions that don't get answered, I'm going to try and leave some time because anyone who knows me would be able to tell you I could talk about this for a full 8-hour shift and I would still be able to come back and talk to you about it tomorrow. So I'm going to try and condense this into palatable information to meet your guys' objectives. But if there are questions afterwards, I will also send Linnea the PDF of this presentation so you can review as needed. Okay, awesome. And just so everyone is aware, it doesn't really matter 100%. I've been working in nonprofits in Central Washington for about 20 years. I've been with Washington 211 for just coming up on 8, and have actually was working with them as a United Way staff member before I actually joined Washington 211. So I haven't been here from the beginning, but pretty dang close. And we'll get into what that means here in a second. So Washington 211. I have to have an agenda because if I don't, I will just start talking about all the fun stories that I think of when I think of Washington 211 and what's going on and how we do it and what we're doing and all of that. So this is more for me than it is for you, but we are going to go over into who Washington 211 is, what we are, how we are doing it, which is going to be the crux of this conversation that we are going to have, because we are going to get into the how we do it is how you guys can use it, and a little bit of what the result is. And the reason that becomes important is because if you don't know why you should be telling someone about 211, there's really no reason for you to do it. So we are going to go over a little bit of what the result is. So who we are. All right. Short story. I'm on an elevator. I've only got one floor. What is 211? 211 is no wrong door access to health and human services in Washington State. That's my short little speech. So if you cannot remember anything else from this entire presentation, no wrong door access to health and human services. I'm going to go into exactly what that means because it kind of, I mean, it's not a huge, none of the words are gigantic, but they can have a lot of different meanings. So we are going to get into what that is, but just as a foundational level, that's what 211 is, and that's what we're trying to provide to every Washingtonian in the state of Washington, which brings us to who we are nationally. 211 is a national endeavor. We'll get into a little bit more localized here in a second. In Washington State, we started in 2006. We actually started in Atlanta, Georgia, way back in the 90s. Everyone remembers the 90s, early 90s, early mid 90s, I guess is when I would say. Washington 211 has 100% coverage, meaning everywhere you are in the state, if you dial 211 in your phone, you are going to reach 211, going to reach us. There was a shaky period where we went from landlines to mobile phones where I had to give a caveat where I was like, but if you're using, I think it was AT&T, then you may have to dial the long form number because they just, all the codes got all screwed up and everything, but not a problem anymore. So we don't have to worry about it. This map is actually technically a little bit out of date. If you look at the bottom there, I believe it says February of 2023. We are supposed to get a new one drawn up this year. And then they kind of were like, you know what, we're going to do a whole newfangled thing. And we're going to do a brand new one on January of 2025. So you guys just missed the new one. The only updates that really aren't going to matter to anyone on this call necessarily, unless you have family in these areas, is Illinois is now completely blue. They are 100%. Believe it or not, Chicago didn't have a 211. I feel like Chicago should have a 211. And then both of the gray states, which are going to be Georgia and Ohio, are now yellow. So we're now up to, I believe it's 99.7% national coverage. And if you look at the bottom there, you can also see that that does include Puerto Rico, District of Columbia, Alaska, Hawaii. So for our purposes today, this is what Washington looks like. So Washington operates on a call center contract basis. Texas, all of Texas, gigantic Texas, has one call center. It's in Houston. Washington 211 decided that what we wanted to do was have a more regional contact center partnership type style. And the reason for that was we wanted to separate our regions out in a way that made sense to the people in those areas. I used to help out answering calls for the King County system and doing their holiday calls. And people would call in and just start rattling off 12-digit numbers. You know, this is the street I'm on. It's 1,200,000 56th Avenue. And I have no idea where you're talking about. But the folks in King County know those areas. I am out of the Yakima office. That's actually where I physically am right now. The number of times folks will call in and we will say, oh, you know what? Actually, you know, we've spent quite a lot of time in Benton County. This is where you go. This is how you get there. These are the local resources that are going on right now that may not even be listed in the database. And I'll get to what that means in a second. Folks in Spokane understand the Ponderay area much better than someone in the Peninsula region. So this is how we segmented all of this out. And we do this with our regional contact center partners, which are listed below. There is one other area that actually isn't listed here. It's my area. It's a emergency virtual contact center. It's because it lives in our minds. And whenever we have a disaster in the state or in one of these regions, and we need to set up either 24/7 or some other form of assistance for either the state or that region, the virtual contact center becomes into being, and we hire on staff or utilize the staff that we previously have, depending on how much staff we need, in order to assist there. The most recent example of that was the coronavirus information line during the pandemic. That was operated out of our virtual contact center, utilizing about 325 different staff members, taking phone calls 7 days a week for 3 straight years. From 6 a.m. to 10 p.m. And that was actually, it was more like 2 a.m. once we got, because we were getting about 10,000 calls a day. But anyway, so this is the statewide system that you guys can take advantage of as it sits right this second. Okay, this is one of our newest initiatives that we are working on. We've got pilot projects going on in the state, and it makes sense, right? This is the idea of whole person healthcare that provides a no wrong door access to the 3 emergency numbers that you really need to know. If you don't know these 3 emergency numbers, I have a feeling everyone knows the bottom right, because if you went to school, elementary school in the 70s and 80s and 90s, call 911. You have a problem, call 911. It worked too well. We told people to call 911. We didn't tell them why. And so now folks are calling 911 because they don't have food in the house, which is an emergency, but is not a 911 life, limb, destruction of property emergency. It's a 211 emergency. It's getting you to food, shelter. It's getting you your bills paid if you're short that month. It's getting you assisted with access to government services. It's everything that isn't either a life, limb, or destruction of property emergency, or a suicide or mental health crisis prevention, or emergency crisis support that you might need in that particular moment. So we are working very hard to create this whole person healthcare system in the state of Washington. We're leaps and bounds around in front of the rest of the nation, and actually I think should probably be a blueprint for how other states are doing it. So this is my favorite graphic in the whole thing. That's why I just leave it up for a while. Okay. This is how we do it. This is the important stuff for you guys, which is why I zoomed through the rest of that. This is how you guys can access 211. I'm going to tell you why you should do that in the next slide here. My favorite is the phone call. So I'm actually going to leave it to the last little second. you can search our database online. I'm going to talk about that. You can text, chat, and email. We want to remove as many barriers as possible for you, your students, their families, everyone you work with, everyone you know. We want to remove as many barriers as possible to accessing these services. My favorite way is the call. I'm going to wait till the next slide to explain, or that I think it's the slide after, to explain exactly why that is. But we want to make sure you guys can access us in any way that you need in the moment that you need it, okay? This is the search engine. If you go to wa211.org and you click on Find Help, this is exactly what you're going to get. This is the exact same search engine that that our community resource specialists are using. So we don't hide anything. The reason I prefer the call is going to be, oh, I screwed them up. Hold on, we're going to come back. Hold on, this is why I prefer the call. The reason I prefer the call is because when you call 211, if any of you were to dial 211, say a student comes in and tells you that they're very stressed out about their home life because their family is struggling financially, and you want to call either on their behalf, or you want to have them call, or you want them to tell their parents to call, what's going to happen is an information and referral specialist, we also call them community resource specialists, is going to conduct an assessment. That assessment is going to be as detailed as the caller wants. So sometimes we have folks call in and they say, I need a food bank. I need a number to a food bank now. Here's my zip code. I don't want to give you any other information. I just need a number to a food bank. Okay. Everything with 211 is completely confidential. It's completely anonymous if you want it to be. It's also, we are able to not anonymize you. We are able to have you be a client, which means we associate your phone number with your name with a bunch of questions. That's the assessment. Is anyone in the household a veteran? Is anyone in the household a refugee? Are they a part of a special needs or a special population? The disability, if there is one in the house, is it TBI related? Is it related? Are you receiving government services as a part of that disability? Where are you on the federal poverty level? What's the makeup of the household as far as gender, as far as ethnicity, as far as the total amount of monies coming in? Is anyone under the age of 5 in the household? Is anyone geriatric in the household? I could keep going. It's a very, very long assessment initially. So we ask folks, do you want to become a client of the system? We'll maintain this record on you. Confidentiality is a huge, huge deal. We are HIPAA compliant. Our database, excuse me, is HIPAA compliant. And so we will ask, do you consent to do this? Because if you do, then every time you call back in, not only do we not need to conduct this assessment, we just need to ask you if anything's changed and make those changes as needed. But then we also maintain a listing on our database of what resources we've already given you. So if someone calls in and they've decided they want to be a resource, or excuse me, they want to be a client, and they say, yep, everything's still the same, I need another food bank, we can look on our database and see, you know what, we already gave them group A food bank. We're not going to give them the same one again. It's clearly not working. We can also say why it's not working. What weren't you able? Oh, well, they only help veterans and I'm not a veteran. Okay, great. Now that we know that, now that we've done an assessment, because maybe the first time they didn't want to do one, we now know where you fit in. Oh, you're a pregnant woman. Okay, well, you may be able to get these resources, these services. Hold on one second. I see a raised hand.
Sorry, are there multilingual speakers for
Yes,
your
okay. Yep, I will. It's on the slide I just squudged through. So yes, we do have we have bilingual. I'll actually just do it right now because I love talking about all of the low barrier stuff. So we have I'm bilingual English Spanish, for instance. We have quite a few. We have one call center that's entirely bilingual English Spanish. It's going to be our Greater Columbia 211 call center here in Central Washington. We have bilingual speakers that are English Tagalog, English French, English Mandarin, but we also have a language line service that enables us to speak in 240 different languages through an interpreter. We have TTY. We also, a lot of our TBI clients, we have a contract with DSHS where we provide resources and referrals for individuals who have suffered or are caring for someone who have suffered a TBI. And a lot of them prefer to communicate over email or text message or a chat feature because it maintains a record for them that they can review if they have aphasia, if they have memory loss, if they any of their issues that may preclude them from having as strong of a memory of that conversation going on. So as I said, we do try to remove as many barriers as humanly possible. However you want to reach out, in whatever language you want to reach out. As a matter of fact, if anyone has someone who is not comfortable with even going through the English prompts to get to a specialist in order to reach an interpreter, if they just push 7 when they call 211, it will immediately transfer them into our queue as interpreter immediately needed. And we will call and connect with that interpreter to figure out what language they need before they even have to go through anything else. That's more of a grassroots thing that we're doing right now because we can't get that out to everyone by normal means, by normal marketing. So anyway, so yes, I'll skip that part on the previous slide. So we are able to maintain that client record if they want. We are able to do it anonymously if they want. During COVID, there was a lot of anonymous calls. People wanting to not have their name, their information listed anywhere. Totally fine. So when they would call in and say, this is my zip code and I need to get a vaccine, we would search for that zip code. We would get them connected. We would put their information into whatever resource would have that vaccine that they needed and get them scheduled for that. The reason I prefer it when folks call in is because our folks are highly trained in being able to search the database. It goes off of something called a taxonomy. I never know if that's a prevalent word elsewhere in the world, but for our database, taxonomy basically means really super specific query. So if you just search food, you're going to get basic food through DSHS. You're going to get food banks. You're going to get holiday food packs. You're going to get any and everything in the food system. So our specialists are trained that when someone calls in and they say, I'd like a food bank, we know exactly how to scale that down to really get to what exactly they seem to be looking for. The other part is that when folks call in, if you guys were to call in and say, hey, I have a student, they have no water in their house. Not only is our specialist, so for you guys, for them, for the student, for their family, it may be I need utility assistance. For our specialist, it's okay, we got to get them utility assistance resources. But maybe if they can't pay for their water, how are they paying for rent? How are they paying for food? What's the transportation look like in this household? Because if they can't get to work, they're not going to get more money coming in order to be able to pay all of these things. And so our resource database is then searched for additional services in order to create that whole person healthcare. That sometimes when you're in that minutia of an emergency, you simply can't think beyond the one thing you may need. That is why we then are able to provide the list of services to the caller, either verbally, with a text message, with a phone, with an email, through chat, however you would like that. Or we are able to also provide a warm transfer to a service provider. Sometimes folks need someone to advocate on their behalf. Already called there and they said they weren't able to assist me. If our database says we cannot see a reason why this person wouldn't qualify for this service, our specialist will call in and say, hey, can you explain this to me? Because either we need to change what it says in our database or something's disconnected here. And we want to advocate for the person that's calling in order to try and get them the resources they so desperately need. So that is what happens when you call. It's why it's my favorite thing. It can be a little bit arduous if you want to do the full assessment and the individual isn't a client in the system as of yet. But it is my favorite for that reason and that reason alone. Okay, hold on. I'm going to go back. I'm going to try and go back. When is it doing that? There we go. Okay. So this is how we do it. This is part of how all of this happens. So if you guys were to call in and your number is a 509 area code, you could get transfer, and you're in, say you're in the Peninsula area, and that's where you need the resources. It may send you to the Greater Columbia 211 call center or the Eastern Washington call center, depending on where it's geolocated. Your phone number is. So we are able to easily and seamlessly transfer these calls throughout our call center, throughout the state, to make sure that wherever you are looking for resources, that is exactly where you're going to get those resources. We do have customizable voice prompts in English and Spanish, as those are the two predominant languages, number 1 and number 2 language in the state. However, like I said, we are able to speak to individuals in over 240 different languages. There was one individual that called in when I was assisting with the holiday calls, and she was shocked, and I cannot remember the name of the language off the top of my head right now. I'd have to look back at the call, but it was a very small village in Ghana that she was from, and that was the language she spoke. She was a recent immigrant, a refugee, here to the state of Washington, and she was absolutely shocked because we were within about 3 minutes, we were able to get someone on the line that was able to interpret between she and I, and she was able to get that assistance with Thanksgiving, actually. Thanksgiving holiday bags with food in them from one of the food banks in Seattle. It was, yeah, it was amazing how they do that. We do have an automated callbacks feature. So if for whatever reason you call in Central Washington, it doesn't happen as much. The King County area, it happens quite a bit, where there's so many calls coming in at one particular moment that there may be a little bit of a wait. We are able to allow for a callback where you just say, nope, give me a call back when it's my next moment in line, so I don't have to just sit here and listen to the music. And then we, like I said, are able to transition from that voice call to text message to email to chat, kind of thing. Okay, the result before I kind of go into a little bit more, the data, which is maybe doesn't seem that valuable. This is why it is so important though. Right now, at this moment, if you guys wanted, I could pull up basically a spreadsheet. Well, for me, it would be a spreadsheet. My colleague Wanda makes these beautiful graphs that I am incapable of making. I'm not very techy. But that would let you know based off of your zip code exactly who's calling in as far as the gender, the ethnicity, the level of disability, what their needs were, what their unmet needs were. We're going to go over that in a second, and what that means, so that you guys know what is going on in your community. There's also a tool, and I'll send that when I send Linnea the PDF. It's called 211 Counts. Like I said, we don't hide anything. You can search it and have it show you based off of your zip code, based off of your congressional district, based off of your state house district, based off of pretty much anything. What's going on for now, the last week, the last month, the last 365 days of folks calling in, what they're looking for and what those breakdowns are, so that you have a better idea of what's going on in your community. And we can use this information to make decisions, not only at a governmental level, but at a local level. What are the needs that we're meeting? Maybe too much. What are the needs that we haven't even touched yet? And how do we make that connection in order to help the people in our area? So this is as of going through June 30th of this year. We do it based off of a fiscal year. So it's going to be July 1 of, at the bottom, excuse me, at the top, July 1 of 2023 to June 30, 2024. And then you can see 2022 to 2023 and so on and so forth. There's a housing crisis in Washington. Was anyone aware? We have over 30,000 different resources in our database. And when I say that, what I mean is 30,000 different groups. So for instance, DSHS has one resource. They would count as one resource, but they have, 12 different programs in our database. So while I say there's 30,000 resources, there's actually a whole lot more. And those resources are local, statewide, and national. So when you look at these numbers here and you see the service needs, that is 327,036 separate resources. So not just DSHS, but of the 12 programs, maybe we gave 12 programs out to one person. That happened 327,036 times in the fiscal year for 23 to 24. Healthcare, you can see it was much higher in 2020 and 2021. I do want to give you guys a caveat real quick. While we were doing the coronavirus information line on the Department of Health, that first year, we all remember it was supposed to be 3 weeks to stop the curve, stop the spread. So we didn't move it out of our generalized data reporting. We didn't have a separate area for it. So that is why that is so high, the 37,000, 23,000, 26,000, those for the 2021 and beyond. Those are going to be the regular years where we weren't expecting to have it need to have its own data. To be honest with you, we when we did it, we expected it to do it for a month, not 3 straight years. So just a little caveat there, but that is a lot of COVID data as well. Like I said, we were taking at one time anywhere between 10 to 12,000 phone calls per day on that line alone, and that does not include regular 211 calls. Family services. Family services is going to be, and I know you're wondering, well, what kind of things can I get from 211 if I call in? For myself, for my family, for my kids, for, you know, and I meant the kids at the school, but for your kids or the kids at the school, we're going to go into what real quick. The last couple slides are going to be some of those needs and unmet needs. Family services, though, is going to be stuff like childcare. I need a car seat. I need daycare services. I need help paying for daycare. But it's also going to be things like TANF. It's going to be things like needing assistance while pregnant, and some of the government services there. So I make that delineation because I know you see government and legal over there in the gray. That is actually going to be much more federal government. It's going to be much more, I need assistance with my mortgage from a mortgage repayment plan. It's going to be Tenants Union of Washington State and tenant landlord disputes, more than it's going to be the family services related to the actual family. Utilities, obviously very clear, plays into the housing and shelter. Food is always there. I do want to let you guys know our top 6 overall service needs have not changed at all, pretty much in the last, well, forever. They've been our top, you could easily say the last decade. They've moved around a little bit. Food is getting bigger. I expect it to probably surpass government and legal, and maybe even utilities this year when we do our fiscal year overview. So top met needs, these are some things, and I'm going to kind of give you an idea as we go down them of what exactly they mean when if they're a little bit ambiguous. So when we say met needs, these are things where one of the things that 211 does is we call people back. We'll ask folks, do you want us to give you a call back to make sure you were able to get these resources? Some folks don't want that. My whole point with 211, really, if you walk away with nothing else, is we want to help you how you want to be helped when you want to be helped in the way you want to be helped. Whatever that means for you is kind of how we want to do it. So if someone calls in and just wants to give their zip code and get a resource, we're happy to do that. If they want to go through the assessment, we love it. We're happy to do that too. If they want us to give them a call back, we're going to ask them when the best time works for them. We're going to give them a call back. And if they then want us to do a whole new assessment, we're going to do that. So when I say met needs, these are folks that we've called back or who have called us back, and we have confirmed that they were able to get the resource that they specifically asked for. Housing and shelter, government and legal, food, utilities, and healthcare are our top 6. So they're going to be the top ones that are on there. Clothing and household items, a lot of times those come with the housing and shelter concerns. If folks are unable to pay rent, if they're unable to pay their mortgage, a lot of times a lot of other things are sliding as well. So you will notice that on here, you'll see the housing and shelter, utilities, clothing and household, the home repair and or maintenance. All of that really is just indicative of the housing crisis we have going on in Washington right now. Really, all of it is, and the rising cost of pretty much everything. But yeah, those are going to be really indicative. This is the statewide numbers. if we were to make this only the Greater Columbia 211 region, for instance, which incorporates where you guys are at, transportation assistance is going to jump up to the top 5. Rural areas have huge issues with transportation, not a whole lot of reliable transportation. And you tend to see, especially in those rural areas, lower rates of monthly income, higher rates of housing now, although they used to be lower, and more issues with employment and overall income. So transportation becomes a huge problem, and how to get people to one area from one area to another. Similarly, that employment and income plays into that as well. When we have someone call in and they say they want to do a job search, the first thing that we ask them is, what's transportation look like? Because, for instance, and I'm going to pick on the Tri-Cities area specifically, because sometimes when I'm doing a presentation like this and I'm doing it over in, say, the Tacoma area, they'll simply say, well, yeah, but you don't need to be in the city that you're in order to get a job. You know, you can work in one city, you can get a job in another. And I'm like, yeah, but how are you going to get there? Because it's not great. The buses or, you know, the transportation is very expensive to get from one place to another, and it's not walkable. That's not a thing that we have on Eastern Washington all the time. So we see those two go together a lot. Again, another reason why I like to call in. Education is going to be assistance. For if you have a low-income family, it's going to be assistance with tuition. It's going to be looking for educational programs, getting into job training programs that are affiliated with educational institutions on the job training and that type of thing. Not necessarily higher college or university, but technical training schools and that type of thing. Home repair and maintenance is a new one, by the way. It's popped up quite a bit as of recently. Disaster is always kind of in our top met needs. But it's not going to be the kind that you're thinking about now that we've all been through a pandemic. It's going to be house fires. It's going to be actually just regional fires. We have wildfires, don't we? Windstorms and issues that come from that as well. So when we go to the unmet needs, these are confirmed needs that we were unable to find resources. What we do when that happens, by the way, just so you guys are aware, because it's interesting and it's always helpful. You're not going to call 211 or tell people to call 211 if you don't know what's going to happen if we can't help them on the phone. This is why we enjoy the regional call center mapping, because our staff gets to know, and our outreach staff gets to know what's going on in different communities. So we are then able to say, okay, you don't qualify for any of the rental assistance that's available right now, or maybe rental assistance more accurately, it's all used up for the month and there's nothing left. So I have heard our staff, I do quality assurance for our calls to make sure that they meet our level of expectation and the training that we've set forward for them. And when I'll listen to the calls, a lot of times I will hear our staff say, you know what, this is the area you told me that you were in. I've heard that there is a church nearby and they are actually doing rental assistance vouchers right now. They don't want to be listed with us because they don't want to get inundated, but you seem to meet all of their qualifications right now. So you should give them a call. We'll go out of our system. We'll Google what the phone number would be, give it to them and make sure that they're able to get that. So it becomes one of those things where we actually have quite a system of mostly the faith-based community, but also other smaller nonprofits that will give us a call and say, we don't want to be listed in the database because we're going to get so many calls. We won't be able to meet all of it. We don't have the staffing. We're all volunteer-based, whatever, what have you. But we want you guys to know what we're doing so that the staff on the phone are able to give that out when it meets the specific criteria and not just somebody popping up in the system. Mental health and addictions, that has been rising in the last 5 years. It has specifically been rising on the top unmet needs. So I want to call that one out specifically. The utilization of 988 and being able to transfer folks from 211 to 988, 988 to 911. I think is hopefully going to assist in getting that unmet need under control.
Kate,
Yes.
there was a question in the chat
Yes.
about if you have any of your representatives that are available to go to like health fairs or
Yes.
to visit with people in the
Yes.
community. because Blanca Salgado was the one that asked.
Okay.
And then I did want to see if I could connect with you in the
Yeah.
chat a little bit later.
Sure.
So after you answer Blanca's question, we'll have you go ahead and finish up so we can hear
Perfect. And I'm leaving
you.
this on here in case you guys need so this work phone, I work remotely. That's part of the answer to the question. I work remotely, so this is my work phone. It goes straight to my cell phone. Please don't call it after 10 p.m. because I will answer and we will have a conversation. But any further questions or any needs for any site visits or any work on health fairs or anything like that, please don't hesitate to email me. This is the process for that. So because we have the 7 regional call centers, typically what I like to do, I'm statewide. So I am, despite the fact that I live and have always lived in Yakima, Washington, and so I'm an Eastern Washington girl, and I so love Central Washington so much. I try very much to have a statewide perspective on all of this. So I go, I get your information, I get where you're talking about, and I immediately reach out to our regional call center and say, hey, do you guys have anyone who is this region specific, who would very much like to go, or it has the capability and ability to go to this health fair, work source fair, employment fair, whatever, whatever it is, presentation, what have you. If they do not, and I am able to make that work, I go everywhere. I've been just in the last couple months, I've been to Vancouver, I've been to Spokane, I've been in the Peninsula area, the North Sound region. I have not yet been to Island County. They invited me, but North Sound was able to take that. So I'm more than happy to take that information and try and make that connection with the regional call center first. Just to make sure that they're able to also give you some very region specific answers, which sometimes at the statewide level there's a lot going on, right? But otherwise, I am more than happy to put that on my calendar and make sure that you have representation as much as possible. That's kind of my job. I travel all over the state to make sure everybody knows what's going on. And so that's the answer there. So I'm going to stop sharing. Hopefully everybody's taken this down. Like I said, I will send it out to Linnea to make sure that you guys have it. And I do see, let's see, looking in the chat. Is there any other questions? There we go. We'll do that. Put them in the chat or ask, unmute is fine for me.
So, Kate,
Yes.
in the interest of time,
Yes.
if I get any questions for you that pop up in the chat a little bit later, I'd be
Yes.
happy to email them to you and then disperse
Great.
that out to the nurses. Thank you so much.
Yes.
It's almost like drinking from the fire hose with all of that
It is.
information. That resource is so amazing. So don't be surprised if I ask you to come back and go over it again with us a little bit later, because sometimes it takes a few times to listen to really understand it all. So
Absolutely.
again, thank you so much for your time.
Thank you,
We
guys.
really appreciate you being here. And if you do have any questions for Kate, you're welcome to put them in the chat. If you're able to stay around for a little bit and answer those questions, that's awesome. If not, I'll be happy to send them to you and we'll keep that line of communication going. So.
Yep, I am happy to stay here. I don't have anything till 10 a.m. So I will just hang out until then. And I will put also our website and the 211 Counts website that I spoke of in the chat, whether you want it or not. So, yeah.
Thank you so much.
Awesome.
All right.
Thank you guys.
Thank you. All right, so we do have Lori Dills from the Office of Superintendent of Public Instruction on with it for me. Awesome, thank you so much. Okay, so we're gonna take a deep breath because sometimes that is a heavy topic, and now we get to hear some of the school nurse updates from Kathy.
Okay, well, thank you so much, Lena. I just wanted to say good morning. I'm sorry I needed to have my camera off this morning for a while, but very happy to see everybody this morning. Well, I could see you, and just wanted to thank you all for being here today. And we're going to go through some updates. So go ahead and share my screen here. Okay, are you able to see that? Very good. Thank you for letting me know. Okay, so we're going to go through some state and regional and also some national updates this morning. And we have a good bit of time to spend together. So I'm hoping we don't have to rush and we have enough opportunity to have some conversations about things. So welcome to December. I'd like to start out the meeting just with a brief statement about gratitude. You know, I really often tell you, I hope, about how much you are all so much appreciated. I just love working with you, and you know, so grateful for your experience and for your skills and for the compassion that you bring to the school districts and to the students that you're serving. And I just think it's always nice for us when, you know, we're really busy, you know, we're listening to information and we're trying to absorb all these new things while we're also trying to do our day-to-day jobs and keep up with things, and just an opportunity to sit back and just think about what we're grateful for. So I would just like you to take just a quick opportunity to write in the chat what occurs to you today. You know, think about, what are you grateful for today? What are you grateful for perhaps over the holidays? If you could just take just a few seconds to just type in quickly something that you're grateful for. I think it's always helpful not only to think about it, but to express it and say it out loud and share it with others. I love this quote by Maya Angelou, and I think it's always something that we should keep in mind. This is a wonderful day. I've never seen this one before. Everything is a new day. You know, every day we have a new opportunities. We have the ability to, you know, to do new programs, to think of new thoughts, to learn new information. So we're grateful for all of those things, but particularly for all of you. Okay, so with that, we're going to roll into first of all, some North Central ESD updates. Okay, so Lena and I have been out busily doing site visits for School Nurse Corps, something that we do a couple of 1 to 2 times per year, get out into the districts and take a look at how people are doing. And one of the questions that we ask about when we come into the districts is whether or not the district system, whether that is the Skyward system or it is the cumulative system, has actually had the district assess the codes updated. What I'm talking about are the Washington State standardized codes for health services documentation. So just as a quick reminder, there are 4 sets of codes that are standardized for Washington State. You could compare these oftentimes to the types of coding that's done in a hospital or clinic setting that is a standardized approach to how we record treatments, or how we record status of patients, or how we record conditions of statements. And, you know, there's the CPT codes. So in Washington State healthcare systems in the school district, we have a standardized set of codes as well. And they're just referred to as the Washington State Health Codes. And those include your reasons for visit codes, your intervention codes, your disposition codes, and your chronic health condition codes. So those, we really encourage people to use these standard sets throughout both of the Skyward and cumulative systems for a number of reasons. One is because it standardizes documentation across the state, so that if we're going to pull data, the data is meaningful and the data means the same thing from district to district as we pull that information. The other thing about these codes, though, is that not only does it give a standardized approach to just documentation within the chart, but it provides a standardized approach to the district assessment and the data that we collect from the schools, both at the state level and at the national level. So that when one student comes in and they have a specific type of condition, it's coded the same way from district to district across the state. It's called the same thing and it's recorded the same way. So these Washington State codes get updated on an annual basis. They get changed. from year to year, sometimes with very minor changes, which could be either deletions or it could be revisions or it could be additions. Any of those three things could happen. And that's a lot of those changes are based on school nurse input. So as people are documenting, they're looking for different types of codes to add. And a committee gets together every summer and goes through all of the requests that come in for code changes, and then they make decisions about what those codes will be. So the new codes for 24-25 are posted in the Google Drive. They're in a folder called Washington State Health Codes. When you open up that folder, you should actually see the 24 health codes in the folder. This is a little screenshot. When you open up this folder, Washington State Health Codes, you should see 24 data set summary, 24 complete with changes highlighted, 24 health code complete, and then more directions. Now, we always recommend that you open up the one with highlighted changes on it, because this can seem like a very daunting job to update all your codes, but oftentimes it's really not. There's not that many changes that have taken place. And in this case, if you open the highlighted version up, you can see yellow highlight on the things that have been either added, deleted, or revised. So if you have questions about this and you're not sure if you know how to do it, you certainly are able to update your own codes. If you have access to your codes, you could do it. If you need IT support within your department at your district, they could help you do this, or you can call the information systems department at North Central ESD, and the staff there can help make sure that you are able to do this, because there's different school nurses have different levels of access within the system, and I don't know that everyone can update their own codes. So you may need help to get this done within your system. But it is important to get it done prior to running your district assessment reports in January or February or March, because then you're going to have more accurate data based on the new codes for this school year. So we're going to be doing some programs about this in January, and in a minute, we'll go through all the dates so you can see when those sessions are going to be scheduled. Another thing that we found is that the Access All School Nurses folder, we are under the impression that as we add or change our folders in here, that it just is automatically updating everybody's view in the system. And I think what we're finding is that on occasion, people's views need to be updated. And people could certainly do that themselves by going in and, changing their address or updating their address, or purging old addresses out of their system. But I think the easiest way for us to do this is basically to, on a regular basis, just go in and reload your address into the system to make sure that you're actually seeing 100% of the files that are in the Google Drive. And we saw this on coming out and doing district site visits. As school nurses opened up their Google Drive, we could see that they were only seeing, perhaps in some cases, 50% of the folders that were in there. So I think that this is just something that we can fix pretty quickly. You should, when you open up Access All School Nurses, be able to see a long list of folders here. You can look at it as a list this way. You can look at it as little boxes or little folders like this. You can change your view over here on this little tab and have your view appear however you want it. But we just want to make sure that all the folders are actually visible to you. So what we're going to do in January is we'll just clean out your addresses in the folder, in the folder Access, and re-give you access again, so that you'll get a little link in your email. It's going to say, we've given you permission to access folders. Please click this link. And when you click it, you then will have reloaded all of your folder views. And so it probably is easier than having everybody try to update their own individually. So it's just a quick way for us to make sure that these are all accurate. And we may need to look at doing this, like once every January on a regular basis, for example, to make sure people's information is really current and they're seeing everything in the folders. If you are ever looking in the folders and you can't find something that you're looking for, please let one of us know so that we can find it for you, or find it because other people might want it. And one of the ways we know people can't see everything is because they are asking for asking us for items that are actually in the folders. And the reason they're asking is because they couldn't see them. And so that was a good clue of looking into what is the problem with these that is preventing people from seeing the information. So if you don't see something, please let us know and we'll take care of adding it. Some position announcements I just want to make you aware of. One is Patera School District position is opening up. Nicole Day's last date in her position is this week, and they have already posted a new position. It's 20 hours per week, and you can link here to their website to access that. The other update, and we're just going to go through this pretty quickly this morning, is that I have announced to the ESD board that I do plan on retiring after the end of this school year from this particular position. And so I'm going to be running through the rest of my contract runs through June, the end of 2025, or at the end of June of 2025. And at that point, whoopsie, sorry. At that point, then we're going to, we will be announcing this in January. There will be a posting for the position, and we'll begin the interview process in January. And with the hope of finding a candidate for this position who will then be able to have some overlap with me before I'm done at the end of January. And so if you have any questions about that, please ask me, and I'm happy to share any information. But I just wanted to let you know, because the board was notified at their last meeting in mid-December. And so, you know, as the information starts to roll out, I really want you to just hear it from me. So that is my news. OSPI Washington State DOH updates. So let's go through some of those. Just a reminder, we did talk about this last month, but just putting it out there again, because I've still had some more questions coming in, and it has to do with the toilet training and incontinence guidelines. So I would like to let you know that this does exist now and was just approved within the last month and a half, and that is the toilet training guidelines. So please do refer to that as needed, because this comes up in quite frequently. And then the other toolkits, again, we have GI and GU tools. Many of them are from Seattle Children's, as well as other types of either staff training tools or guidance on GI and GU issues. And you should see those again in the Google Drive in the toolkits under GI, GU, and toileting. Another reminder, this is about the model policy and procedure reviews. So we did talk last month again about these changes that have taken place, and wanted to make sure that you were aware that the policies and procedures have been modified for both opioid overdose response as well as anaphylaxis. So we could just see a show of hands or in the chat, and Sheila or Elena could just kind of modify and comment on this. And that is, you know, has anybody looked yet at either of their policies in terms of making updates to their existing policies and procedures?
So Michelle says that they're in progress,
Okay.
and Lisa is working on it now.
Very good. Okay.
So is Susan.
Okay, very good. All right. And these actually, you know, again, these are changes were made because the RCWs around opioids and anaphylaxis care were revised. And so as a result, the laws change. And so we just want to make sure, you know, to keep your health services policies and procedures in compliance with the RCWs. You might want to take a look at these and discuss with the superintendent and get them on the agenda for your boards to review. Okay, another recent law, this was from House Bill 5790. So this is related to heart safe schools and cardiac emergency response plans. So this law actually has been put in place. It doesn't take effect, you know, some of these requirements don't take effect right away until 26. However, it's really time to start thinking about planning and what your involvement is going to be in these kinds of things. I know there's been a lot of interest in, for example, the AEDs. You know, the part of the result of this law was some funding that was set aside so that districts would be who needed an AED would be able to get some funding to purchase one. So OSPI is responsible for that funding. If your district is interested in applying for a grant to obtain an AED, and that would include enough funding not only to purchase your AED, but your AED supplies, perhaps an AED box to put on the wall, and even some of your training expenses could be wrapped up into the grant that OSPI would provide. I would encourage you to apply quickly. There is not enough funding in that account for every district to receive an AED. There isn't that much funding. And so if you're interested, I would suggest that you apply soon. The grant applications are wrapped up in a program called the OSPI Education Grants Management System. So this is just a product that OSPI operates. All of its grants are held within that system, and your district should have an administrator. There's a link here to the EGMS administrator list, so you can see who at your district would be the person who has access to that account. Now, they could give you access if they apply. They could ask OSPI if they want you to do the grant application yourself, and rather than have them do it through the system, they could request that you get that access from OSPI to do it, or you could just do it collaboratively together with them and get that application in. So some things to think about if you really would like one of these AEDs and you want to have a better chance of receiving funding for it, then things to think about are participating in the Heart Safe School designation program, and because that is going to increase your likelihood of receiving grant funding, as well as your need. You know, is this something, if you already have 6 AEDs and you just want an extra one for something, but you don't have a high need for it, then I would suggest that you perhaps, you certainly could still apply, but your chances of being awarded one in that situation are not going to be as high as somebody who says, I have one AED and it's broken and it's so old I can't get any more replacement parts. So they'll be looking at those type of criteria in that decision-making process. When it comes to the documents, if you're looking for grant application information, that is all in the Google Drive. You can look under your toolkits tab under CPR, AED, first aid, and you'll be able to find a SERP file in there. And all of the documents that you would need are downloaded in there. But your application does need to be filled out using the EGMS system. Okay, another going along kind of related to this with House Bill, again, 5790, is bleeding control equipment. This is the one that's effective 26-27, and this would require staff in your district, at least a few staff in your district, to be trained in how to respond to bleeding emergencies. And sadly, as we just witnessed here within the last 48 hours, we've had another school shooting, so many students injured, deaths in the school, and the importance of having people who are able to respond in those types of emergencies is just totally invaluable for the school to have at least some people who can help support students and staff until EMS is able to arrive. So there's guidelines on how to complete this. You need to have, just a few employees, again, depending on the size of your school. You do need to select a curriculum. There's 2 that are recommended. One is by U.S. Department of Homeland Security. It's called FAST. The other is the program approved by American College of Surgeons. That's the Stop the Bleed program. So either of those programs would meet your training requirements for your staff. And if you're interested in train the trainer training, particularly particularly for Stop the Bleed, please connect with Lena for some assistance so that you can learn to, so we can actually expand this knowledge out so that the people feel very comfortable with providing these very basic skills on how a person could address a bleeding issue and help staunch that bleeding. So that's coming up. This is just a quick reminder. So this is related to Washington State Apple Health and Medicaid. This is Medicaid rewards. This is just something I want you to keep in mind for your students and your families, that they are eligible based on certain types of perhaps office visits or receiving immunizations. They're actually eligible to get a monetary reward from Apple Health. And so there's a little flyer on here that describes the rewards program. If you have students who are in the Apple Health program and their parents are getting these types of services provided to them, just as a reminder, you could have these posted and have them available in your health room and or at your kindergarten roundups or wherever you're going to be connecting with family members to remind them about these options for them. Okay. Reminder about the DOH environmental health and safety. I do sometimes get, and as we're coming around again and doing site visits and touring different health rooms and looking at how health rooms are set up and the different types of equipment that health rooms are needing, we do look towards the DOH environmental health and safety guidelines for information about cleanliness in health rooms and standard equipment in health rooms and use of cleaning products in health rooms and airflow in health rooms. Those are really big, important issues because you want your health room to be a clean, safe place for kids to come or staff to come if they're going to be working in your health room. And so there's guidelines available out here. These are all brand new for 2024. And if you're looking for specific information, you can certainly open the documents up and search for specific things, and you'll be able to locate them in these documents. Some updates from Washington DOH from the immunization office. I just wanted to, and I did share these with you electronically by email, but just some reminders about these different changes. The first one is about the polio documentation. There was a little snafu in the polio documentation in the WAIIS system, and some polio vaccines were not recorded correctly in the system over a period of time. And so Washington DOH is fixing that. They're going to go in and make some changes to records in December of 2024. So probably if they haven't started, they will be doing it soon. And they're actually going to be changing some of the documentation entries in there that are related to the polio vaccine. Now, what will happen when this occurs is that some of the students may appear as being out of compliance with their polio vaccine, which they will be, because they would have received a polio vaccine that is no longer accepted by the United States. And so they may have gotten it in another country, and it was erroneously entered as being appropriate when it was not. And so that is being corrected. And if you find that you end up with students who have a out of compliance polio, that could be why. And so there's information on this document about how to fix this, what's going to be done to fix this, and there's contact on the slide if you have any questions about it and who to contact about any issues with WAIIS and school module documentation. The other update is related to the recent program on pertussis. So many apologies, that was full, and I'm sure there were people who were trying to get into it, and for some reason the Zoom room would not hold any more registrations. And so that presentation was recorded. You can access it here at the pertussis updates link. It's about a 1-hour presentation, and you'll be able to hear all of the updates that were presented. And you can also apply for credits for that program. Also, even if you're listening to it remotely, you can still get credits for it through March 5th. The other thing I just wanted to point out is Washington Department of Health records many of their sessions on immunizations. And so if you're looking for training, if you need more guidance on immunizations, or you just want some refreshers on immunizations, there's a whole immunization training page on the Washington DOH website where you can link to all of these recordings. And the link is here on the in a screenshot, and so you can see what it looks like. But you can scroll down this whole page and come up with 20 or more recorded sessions that are very recent on immunizations and vaccine preventable diseases. A couple of things are already out and posted, so things to be thinking about already for next school year. I can't believe it, but we're already thinking ahead to 25-26. And so a couple of things are already posted out there. So if you want a head start on anything, you want to print, for example, your IVERS update. So your IVERS, as a quick reminder, is your individual vaccine requirement summary. It's an excellent tool for you because it goes through quite a bit of detail on the different types of immunizations that are required, and the different schedules for those immunizations, and it's already been updated for next year. So I would recommend that you print it and have it available and begin using it as a resource. The other tool that's already been posted is the requirements chart for parents. Now keep in mind there's two different charts here. So there's a parents chart, and then there's chart for healthcare providers. So the parents chart is a little bit shorter. It's only one page with just reminders, and it's written in directed towards the parents. The healthcare provider chart has not been posted yet, and it's generally a two-page document because it has kind of this quick chart looking cheat sheet on the front, but then it has a lot more information on the back as reminders about immunization. So a couple of new things to watch for, and then we'll let you know as more tools become available. And finally, I think for the Washington State Legislative session, we just want to make sure you're aware the session is coming up and plans are being put together by various nursing groups in the state of Washington, and their approach to talking with legislatures about what are being seen as priority needs for nursing in the 2025-2026 biennium. And so there's lots of things, that could be addressed. There's a lot of attention right now on school nurse recruitment, on school nurse retention, on school nurse development, as well as pretty standard issues around school nurse wages and school nurse hours. So lots of things for these different groups to focus on. And, we've got another slide coming up pretty quickly. We're going to talk about how you could participate in these programs and how to register if you would like to get involved by attending Lobby Day, for example, over in Olympia. There are likely going to be a couple of focus areas that are going to be specific to school nursing. One has to do with ESAs. What is the role of the ESA and the school nurse? Which and who will have ESA certification as a school nurse is coming up, and best school nurse mentoring financial support is coming up. So those two things, if they make it to the top of the priority list, will certainly have an impact for school nurses. And then finally, we have a couple of reports that we're going to be asking for feedback on. We've talked in the past about the BRE Collaborative and the BRE reports and the work that they have been doing in addressing different types of healthcare needs. They have a couple of documents out in draft form. One of them has to do with heat and wildfire smoke, and the other one has to do with behavioral health and early interventions. And what they're asking for is anybody, who is interested in providing some, public comment on these is able to do that. And so there's a couple of links on the slide to each of these two documents. If this is something that you would be interested in providing feedback for as a school nurse, they would love to hear from you. And the little caveat is there isn't a lot of time to do this. So this would be due by December 22nd. So those links will be active until that time, and it take you probably 20 to 25 minutes per topic to go through those and actually read them and provide some feedback. But you are very welcome to do that if you would like to. Okay, let's do some national program updates. So another update that I sent you electronically by email was just a reminder about the Pink Book and about a new Pink Book training that's been scheduled in Washington State. So if you're not familiar with this book, this is an excellent resource for you. It covers a wide range of immunizations and vaccine preventable diseases and good current treatment plans. It's wonderful except for the fact it has not been updated since 2021. So we're still operating off that fourth edition. So it's just a little caveat for this particular tool in that we're kind of waiting for a new version of this to come out before we purchase more copies of it. We do have one version that we have in the lending library right now. However, you can download this free of charge. So the CDC Pink Book is free. You can download it chapter by chapter, or you can just link yourself to it and open the chapters and read information by chapter. You don't even have to download the whole thing, but you can get to it on the CDC website at the link for chapter downloads. You also have access to recorded sessions. So these are about 1 hour in length. There is a session on a variety of topics. You know, a lot of them are disease-specific topics where you can walk through, like, I need to learn about measles. You can watch a webinar on that. And that information is taken directly from the Pink Book. And it is a series of about 20 different programs available to you. And then finally, the great news is that Catherine and her team at Washington DOH have arranged for a Pink Book training to occur in Washington State. So this is really exciting. It doesn't happen often that we actually have the live training for this program and the contents of the manual presented in the state. And so this is going to take place in June. It is going to be the 2nd through the 4th in Tacoma. And there's no registration information for it yet, but something to keep in mind if that's a big interest of yours or a goal for you for this year is to learn more about immunizations, then that is a program you might want to consider looking into. We'll post information about it as it becomes available. This is another new tool that's just come out recently. It's a food allergy management in schools, or FAMS information. I love this book because it covers a lot of, it's kind of a real evidence-based approach to how to manage allergies in your schools. And it's a great supplement for the information that you already have from OSPI, as well as the FAIRS program that also looks at allergies and anaphylaxis in the school setting. And in fact, they are actually FAM has a relationship with them. So this book is actually really a collaborative effort. You can access it here and download it for free. So it's a great tool. The guidelines are available in both English and Spanish, as well as the individual tools that support. So when it talks about like teaching aids for a variety of different staff members, the tools are actually available in both English and Spanish. And those are, you can either download those, or you can go into the Google Drive and go into nutrition under toolkits, and you'll see where many of these tools have already been downloaded for you, and they are available in that drive. So this is just an example of some of their staff training tools. And again, so you not only have some printed tools that you can use, but you also have some training videos that you can use as well. And this is just one of the examples, and it's called Keeping Students Safe and Included. It's KSSI training, and there's a secondary program in there as well. Either of these could be used for excellent tools for training your staff on allergies and allergy management, and how to recognize and prevent kids from getting exposed to allergens in the school setting. And again, both of these different, all these tools are available in both English and Spanish. So I really appreciated that. Okay, couple of contests coming up. These are things to share. So I encourage you to share them widely with folks at your district who might want to be involved in these things. It might not be things you specifically are doing as a school nurse, but certainly has a health component to it, and would encourage students to get involved in these. This particular one, 2025 Maurice E. Hilleman Annual Essay Contest. So this is a contest in which students are asked to write a essay, and their essay has to do with getting to know Dr. Hilleman and his efforts around immunizations and why were these things important. So I think it's a really good opportunity for kids to even think about why should there be vaccines in the world, especially in our current climate when we're having so many conversations about, well, do people really need to be vaccinated or not? Do people really need polio vaccines? All of these kind of questions that are coming up, and I think it's a great opportunity for people to actually investigate into the science of vaccines and read about and learn about, well, why are things the way they are today? So this is an opportunity for kids in the grade 6 through 12. The deadline is not until February, but there's a wonderful toolkit. So there's even a guide for students that students could access, teachers could access, in how to write a really good essay. And there's monetary awards associated with this particular essay, which are always nice. So kids looking for a little money that might help them with college, for example, I think the highest amount is a $500 award for selected entries. So that one is coming up. This one is one, again, that you might want to be involved with or post information about for your students. It's always a lot of fun because I love their posters that they create and then launch out across the state about poison prevention efforts. So the posters often that are coming out and you see posted around the poison prevention program are posters that students created and that were selected as the winners in this poster contest. And it's time again for that to come around this year. This year's theme is pick your poison. And so here's this 4 simple steps. Choose a poison you want to write about, explore the poison, how has it affected people, and design a poster around that. So in this case, it's very age group specific because it ranges from K through 12. And so, the posters are going to vary quite a bit in what they look like. And I think that's the beauty of it, is you get all these great posters created by kids. And it's really hard to select from whatever are going to be the winning poster designs, because there's so many good ones and very creative. So this would be something you could encourage kids to do. There's a link on the slide that'll take you to the poster rules. Again, the deadline is not until February, but something for kids to start working on and thinking on of how they could contribute to this. Okay, let's go through some training events and resources. So just as a reminder, we talked a little bit briefly about, upcoming legislation around having like stop the bleed courses or other kinds of trauma response courses. And so just a reminder that NASN does have a course available on school emergency triage training. Now, this course is really more about planning. It's not about hands-on. I want to provide clinical triage, and how am I going to do that? That would be something you could work on with Lena and with other educators as you want to learn how to apply the skills or train others on the skills of bleeding response, for example. But this is really getting to, how do you plan it? How does the school nurse get involved in helping put together an emergency response plan? And the interesting thing about the recent school shooting is that the call went in for help from a 2nd grader. So and the fact that they had as few injuries and deaths as they had, the school actually attributed to the good planning that had gone into place to respond to those kinds of emergencies, and including the drills that were done, and how the students immediately could recognize and differentiate what was a call for a drill versus what was an actual event that was occurring. And the quick responses from students and staff were really led to a safer outcome at that school. So it's really, really important to have good plans in place. I know people get frustrated by the amount of paperwork or all the different plans that need to be put in place, but really it happens more and more frequently. We always hope it doesn't happen to any of our districts in our region, but it has happened in our state, and we really need to be ready to respond. And so this has a number of modules that go with it. It's all done online. There is a fee for this course. It's $90, and that is for NASN members. So it is not free to attend. So as with other courses, if you're in School Nurse Corps and this is on your goal list for this year, then you would want to do your registration via Sheila rather than independently. Another course is coming up. I just wanted to make you aware of. This is called the Gather event. I'm not sure if you're familiar with it. This is not its first year. It's been going on for a while. And Gather stands for Generate and Teach Health Equity Routinely. So this is kind of the purpose of this course or this activity is really to help people think about equity in a different light than rather than thinking about it as something as this is something we have to do. I don't understand why we have to do it. It's just one more thing to add to our plates. The purpose of this training is really to help people see how do you incorporate equity into everything you do on a daily basis. It is not about like another box to check or another document to create or something like that. It's really how to change people's way of looking at equity as just a standard component of day-to-day work. So this is an opportunity to get together with a number of people from across the state. They could be from clinics, they could be from hospitals, they could be from schools, they could be from a wide range of agencies who are involved in care of students. And so it's there's limited space. So you would want, if this again is something that you are interested in committing to, it is a 3-month commitment. You can see all the training dates. There's 6 different dates when you would get together with your group. So this is a group activity where you're going to be interacting with others from across the state. So Monday evenings and Thursday afternoons. There is a registration fee for this, but the registration fee is totally refunded when you finish the course. So when you're done with it, you can get your money refunded. So it's really just a kind of a mechanism to get people to actually commit and stay in the course and complete the whole thing. Because once you're part of the group, you don't want to be leaving. You want to remain with that group and work through these ideas with them at all of these scheduled meetings. So there's a link here if you're interested in registering for this. There's also a contact person if you have questions about this. And you can certainly just go to the WCAAP program and search that out and open up their webpage, and it will tell you about this different program. But if this is an interest to you, I think that you would really enjoy this. Next is the Seattle Children's Pediatric Nursing Update. We get lots of questions about this course. This is an annual course, and it is scheduled for the 24th of January this year. It's always in January. Always has a strong pediatric, school nurse focus for this program. The topics that are going to be presented this year: therapeutic touch, abdominal pain, mental health check-ins, pulmonary issues, diabetes management, and gun violence and safety. So multiple sessions. This is all done remotely, so you can do it, from school or do it from home. Registration fee for this is $125. School Nurse Corps, please check in with Sheila rather than registering independently for this. And we encourage you, if you are not a School Nurse Corps district, to discuss with your superintendents or supervisors about your interest in attending this particular course, because it's just excellent. And so we don't like or want people to miss out on it. Prevent Blindness, Closing the Gap. This is a webinar that was offered and was recorded. So I just want to make sure people are aware of this course because this comes up a lot in discussions with school nurses about, we did the screening, we made the referrals, but how to get the families connected, how to close that gap on the referrals that are made and then the referrals that are completed. And so that was the purpose of this particular webinar. It's called Helping Families Remove Barriers to Eye Care After Receiving a Vision Screening Referral. So there's the whole thing in that topic. And the slides are available at this link on the slide, as well as the link to the recorded session are here. And this was something that was done by Prevent Blindness, so an agency that we certainly support. If you have not completed the Prevent Blindness Children's Vision Screening Training and Certification course, if you're a school nurse corps nurse, we do encourage you to complete that course. If you're new to school nurse corps, you will automatically be assigned to it, and so you should be receiving links from Prevent Blindness about completing that, getting that course completed. There is a fee to attend that course. So if you are enrolled in it and you have been enrolled through Sheila to attend, we ask that you please complete it. At this point, we had how many completed, Sheila? How many were on the list from last year? 10? I can't hear you.
All of the ones we signed up last year.
Yes,
completed
we
it.
knew all. How many was all? 10? I think 10.
Oh, no, more than that.
More than that. Okay. So we
Sorry.
had 100% of the nurses assigned to this completed last year. Yay. So that was really good. So if you are interested in this, then we encourage you to follow the link and see what this course is about. And if you get assigned to this course, to please complete it. Lobby Day, we talked about briefly already, and the registration to attend. I just want to make sure people know, because that is coming up and it's going to be during your winter break. So 12/27 is the date to register so that you get a ticket to attend. The actual Lobby Day is February 4th. So little ways out there, but if you're planning to go, please register. When you go to these events, it gives you an opportunity to get together with nurses from across the state, both school nurses and others who happen to be there on Lobby Day. There is an orientation that goes along with this, so that if you've never done it before, you have a chance to hear about what is it like to do this, what are the expectations, what is my day going to look like. So there's an opportunity to do that, and then certainly an opportunity to schedule meetings with your state legislative representatives so that you can have some one-on-one or small group meetings with them to talk about school nursing issues. So it is a great opportunity. It is unfortunate it's in February, which sometimes is a horrible driving month to try to get across the passes and get over there to it. But at our January meeting, we're going to talk about how could you participate in it even remotely? What are the remote options to participate? How do you submit your opinion? How do you submit to your legislatures? If you've never done it before, we'll go through that process so you can see how you can get your opinions in, whether or not you're actually able to go to Lobby Day or not. And if you have additional questions about Lobby Day, please email Taylor Mason. Taylor is with the Wenatchee School District and is our Snow legislative representative. So her email is down here at the bottom. Upcoming events and training. So a couple of things coming up related to BEST. We've got our school nurse mentor training scheduled. The next one is coming up January 13th. So if you are interested in learning more about, even if you're not serving as a BEST mentor, it doesn't matter. If you just want to learn how to mentor other nurses, you are very welcome to attend this course. You can attend by Zoom, and it is from 8 to 3 o'clock on the 13th. And again, we'll do another course on June 9th. The roundtables are offered almost monthly, with the exception of April. We have a monthly roundtable, and you can see all the dates there. Those are all from 2 to 4 p.m. You can register for them in PD Enroller. Dish programs, we've got programs monthly scheduled. Those are all 3 to 4 p.m. And you can again you can register for them in PD Enroller. And then we have some district assessment session dates coming up. So that's to help prepare people for the district assessment. There have been some changes to it from last year. So not huge changes, but we want to do a little clarification. Also a chance to go through last year's data. So you can see, well, what did we collect last year? What did things look like? To give you some ideas on what's happening with school nursing and with school health throughout our region of Washington State. And there's 3 different sessions scheduled. You're welcome to come to any one of them. They're all 1 hour, so 3 dates and the different timeframes for those. And you can register for those in PD Enroller. Okay, and again, ESA certification. So that's going to come up as a potential topic of interest when we talk about legislative priorities, and it's about ESA certifications of school nurses. So we just want to put out another notification about the ESA certification course dates. So we've got 2 sessions scheduled at this point. January 25th is the start date for the WSU course, but that's the date of the live session. So prior to that date, if you're looking at ESA certification and you want to take the WSU course, you would want to start looking at registering soon, because you only have so many weeks to complete all of your pre-work. So you have about 13 hours of work that you need to complete independently before the January 25th in person, which is, in person via Zoom session with the instructor. So you want to get registered for that if you would like to take that particular program. If you want to take the program through UW, that's the Foundations for School Nursing. That one is more spread out. So you're going to have more like weekly meetings, and they're going to be more short duration, repeated meetings. So that one runs from March 31st through June 6th. So it's a longer time frame. You're going to have that. It's all, again, it's online. You don't have to go anywhere to it, but you do have a commitment to attend regularly scheduled meetings. And then the course fees for those, and then the clock hours associated with those different programs. Does anyone have any questions in the chat or anything, Lena, that I have not seen? Because I don't see the chat.
We'll go back through. I haven't seen a lot of questions about it. There were just some comments about Michelle had a comment about the survey for the AED, not the survey, sorry, for the application for the grant, that it was very simple process. And of course, when you announced that you were going to announce your retirement, that there were a lot of people that were saying thank you, and for all of your support and your help. And
oh my gosh, I just love you guys. I can't tell you how much I have loved this job. Working with you has been a true joy. I was surprised you're not jumping up and down going, oh my gosh, we didn't think she'd ever gonna leave. But I do really love it. And I do want to, I do, I can talk about plans later, but these contracts are a year in duration, and I decided that this would be a good time for me to not renew another year of the position, and to move on and have someone else come on and pick up this work and continue on. So thank you. I appreciate any comments that you have in there. I can't tell you how much I have really loved working with all of you in this position. So just in closing, a note of thanks. I can't tell you, I appreciate you. I value you. You guys, I don't think that you sometimes know how much impact you have on the lives of students. Really. I know you feel like you're pulled in a million directions, and you're so busy, and you have all these things that you need to do, and you don't have enough time. And that's true. And we all feel that way. We all feel that way on a day-to-day basis. But I know that you feel it very acutely, because you're right there in the health room with those kids coming in and having those needs, and how important those needs really are, that they are addressed, whether it's the kid coming in with a crying because their stomach hurts, or the kid that comes in who lost a tooth, or the kid who came in who fell. All these kids with all these, both acute and chronic conditions really rely on you, whether you can be there physically with them on a day-to-day basis, or you aren't there every day, but you have put processes in place and you have trained the staff, and they know exactly what to do to provide care for those students, to keep them safe, to keep them healthy, to keep them learning. I've seen the thank you notes. I've seen kids thank you notes written to their school nurses and posted in some of your offices. And it's just the most wonderful thing to know that you have made that difference in the lives of kids, and that they've taken a few minutes to say thank you, and let you know how much you have been appreciated as well. So I thank you. I'm not going anywhere yet. We've got almost 6 months here of time where we're going to be working on continuing to move forward with our plans for best mentoring, getting those things lined up for next year, making sure we have orientation lined up for new school nurses this summer. Having our school nursing event in May. So that's going to be coming up. We'll have our school nurses day program. We hope everybody can come, or as many people as possible are able to come and have a big party and celebrate National School Nurse Day, and as well as learn some new information. There's always something new to learn. So those things are all coming. And so just still lots to do, working our way through it. And we'll just keep trying to provide you with as much support as we possibly can. So any questions? That's the end of my presentation. So I'm going to stop sharing. Okay, so
Great.
we're about at the end of our time, Lena.
Yes, we are. Does anyone have any questions? There was a lot of information there shared today with Kate and with Lori and of course with Kathy. So if you have any questions at all, please feel free to unmute your mic and ask, or put it in the chat. If you have a question for our other presenters, please feel free to email me and I'll be happy to get that information to you, or you have their, or you will have their direct contact information, and feel free to contact them directly. I'm sure they would be happy to hear from you. Carrie has her hand up. Go ahead, Carrie.
Just really quick, reminder, I am your Area 9 rep for snow. I did send out 2 emails last week regarding some information about legislation, lobby day, and elections coming up for our snow board. If you did not receive those emails, please contact me at charris@qsd.wednet.edu. So I can make sure that I have your correct contact information. Thanks.
Thank you, Carrie.
And Carrie, maybe it would be a good idea for Sheila to send you a current list.
Sure.
And we should have, because we should have everybody current at this point on our website. So under on our school nurse directory, you can find. What's that?
I said I keep forgetting to look there.
Oh, yes, yes. Well,
it's
easier. It's easier if Sheila just sends you as a spreadsheet.
Okay,
so you can just cut and paste and update your distribution list.
Wonderful. That would be
okay. Thank you. Thank you so much. And thank you for posting that information. We hope people are interested in getting involved with SNOW, School Nurse Organization of Washington. It is a great opportunity to develop leadership skills in working with a wonderful group of people who are all interested in making school nursing better across the state of Washington, and working crossways with other states as well. So if you have an interest in that, Carrie sent out all long list of, potential jobs that are available for people who want to get involved with SNOW. So if something piques your interest there, please reach out.
There is one posting that was not on that email. The NASN director for snow is coming up in 2 years. But in order to put in for the NASN director, you have to serve on the board for at least 2 years. So if you are looking to be a NASN director, which would be, you would be the liaison between snow and NASN, you do need to have at least 2 years on the board before you can put in for that position. So I'm
Hey,
done.
think ahead, you guys, think ahead. All right.
Thank you so much. All right, well, we will make sure that the slide decks from today get posted into our Google Drive for you. Again, just to reiterate what Kathy said, if you are having issues with finding things in the Google Drive, please reach out to us so that we can help make sure that you have access to all of those documents and resources that we have posted up there for you. So we'll make sure that this meeting gets posted in the Google Drive and on YouTube as well. And as always, if you are wanting to have your time count here for PD Enroller, or for, I'm sorry, clock hours, make sure that you are registered with PD Enroller. If you have any questions about how to do that, please reach out. I'd be happy to help you get connected with that resource as well. So, all right, it's 11 o'clock and we're going to sign off and say thank you so much for all you do. And we wish you a very, very happy and restful holiday break in the coming days. So